Okay, this is part 2 of the 2017-2018 grant writing workshop. This is the GeMS and grant writing tutorial. So this is going through the system and giving some tips on how to make your application as easy as possible. Okay, so we're going to go through all of these fairly quickly, and then what I will do is get into the system and walk you through some of this as well. So via online grants, we want to reduce the amount of paperwork, provide a central location for applicants and grantees to complete all tasks, and keep a record of the years of funding. Assist in evaluating their project, and then provide us more time to build relationships and get out into the community. So there are 4 user roles. The 2 that are the most important are project director and authorized signer. The project director needs to be the first person within the organization to register in the system. And once they have registered, affiliate staff can go in and approve that user in the system, and then that person can actually approve all other users within the organization. So they have the most capability within the system to do all of the activities. The authorized signer role needs to be given to someone within the organization that has the authority to sign legal documents or contracts on behalf of the organization. The authorized signer needs to register and be approved prior to the creation of the application. Otherwise, they won't be attached to it. They will be in the system but will not be able to see the application. We can fix that, but it's easier if this is done at the front end. So viewer role, this is for anyone who you want to be able to look at the application or look at the reporting and everything, but not make any changes in the system. And then writer is the role that can be given to someone. Maybe you have a contract employee, that comes in and does grant writing for you. They can write and they can make changes, do the reporting, but they cannot submit anything. They can't submit anything to us. So the project director is the only one that can initiate an application. They're the only ones that can initiate the progress or final reports in the system. And then the project director has to submit the application to the authorized signer. Then the authorized signer submits it to Komen. It's a 2-step process to do this. So registration, so the website is affiliategrants.komen.org. That link is on our website as well as in the RFA, but this is what the home screen looks like. So you'll see down here there's a register now button. So for anyone who has not registered, you would click on that. If you already have a username and password, then you would just log in here. So you would click register now, and then this is what will come up. So anything with a little asterisk next to it is required. So first name, last name, title, email address, position at affiliate. So you will click on this drop-down menu, and if you're applying for a grant, you will say applicant. So once you click on applicant, then you're going to hit this pink go button, because if you don't hit the pink go button, nothing below, because what this does is it narrows you in the system, and it gives you choices. If you don't hit the go button, it can't narrow, so you have to do that first. Then you will click affiliate state. So you'll click on the drop down, find Utah, hit the pink go button, then the affiliate box will auto-populate with Utah affiliate because we're the only one here. You'll click on Utah affiliate, click go. If you are an existing organization, so you're part of an organization that has applied for or received funding in the past, your organization is in our system already. So what you would do is click on the down menu, and then you would scroll through and look for your organization. If you are a new organization that has never applied before, what you will do is you will click New Organization and then hit Go. You'll create a username and a password and confirm the password. So if your organization is already in, you will not see this next screen. It will just tell you thank you for registering, and then you'll get an email saying that. But if you're the new organization, you'll get this page. And so this is where you would put your organization name, the address, city, state, zip code, phone number, and then you will be need to upload your nonprofit documentation. You would put in your tax ID number here and then upload a copy of your nonprofit documentation. After you save this information, you'll get 2 emails, one that says the registration is submitted. If you are registering for the first time or as a project director, the Komen staff will approve your registration. All other should be approved by the project director within your organization. We can do it here. We can approve those, but again, I don't know who at your organization you want allowed in the system. So it's much better and much more safe as far as privacy is concerned that the project director, who knows the employees at their organization much better than I do, to go in and approve those. So for those project directors, this is what the screen looks like to do a user approval. So I don't have the screen that shows. So from your home page, there will be a My Administration tab. You would click on that, and then it'll say User Approval for Project Director. You'll click on that, and this is the screen that comes up. The easiest way to search is to come here to User Type. There's a little drop down and click New and hit Search, and it will bring up anyone within your organization that has newly registered in the system. So then you would come down here and you would click who you want to approve. So you'll click on that name, come up here, and then you're going to approve your user. You're going to assign the organization. You're going to set the person's role, so whatever you want their role to be, whether it's authorized signer, writer, viewer. Active date will default to today's date, and then an inactive date you can set if you want to. It's not required, but if you know that you have, again, you have someone that you're paying just to write your grant, and you know you want to inactivate their login, after a month, you can set that to happen. Okay, so now I'm going to go into the GeMS tutorial. Okay, so you'll see here, I have just a Google screen, so I'm going to do affiliate grants. Oh, and mine's much longer. But it's affiliategrants.komen.org. And here is where you would log in to the system. This is where you would click, again, to register. But we already have a login. So applicants. Okay, so you'll see that I have logged in as an applicant, and I have several things to look at here. So there's view available proposals, my inbox, and my tasks. You'll also see here my administration. This is where you would go to do user approval for other people within your organization. I'm going to talk about these very quickly at the top. So my CG application, CG stands for Community Grants. So this is where you would come to look at past grants as well as open grants. And once you have initiated your application, this is where you would come to find it again. You don't need to go through the process of initiating another application, because all it does is create another document. This is where you will find it once it's been created, and I'll walk you through how to do that. My SG applications, this is small grants applications. We're not currently doing small grants at this time, so you can ignore that one pretty much. My CG reports, again, my community grant reports, this is where you will find your progress and final reports that you have already initiated and or completed. There is a different step for reporting that will be handled on a different training. Again, my SG reports is probably irrelevant for you, and then my legacy grants. So if you're part of an organization that has had grants dating prior to 2012, all of those would show up in your legacy grants. Everything else, once GeMS was implemented, would be showing up here. Hopefully that helps. This is also, so my organization, it shows your organization information. It shows your organization members, so who's in as members. All of your documents, so all of the applications, all of the reports, everything would show up here if you wanted to search that way. And then organization details. Excuse me. This is the type of organization, the service area that you cover, and then this is where you can also go in and upload your nonprofit documentation if you didn't do it at the time of registration. Okay, I'm going to go back to my home. So this is what your homepage will look like for the most part. You may not have this My Tasks bar at the moment because you may not have initiated anything, but I'll get to that in a second. I don't use my inbox. I don't typically send messages through the system to applicants or grantees. I usually email them outside of the system. So any of these messages will probably be system-generated messages, just things like your user registration has been approved, things along those lines. So to initiate an application, what you're going to do is come here to View Opportunities. You click on this, and this is going to bring up some really weird looking information. So we have, as I mentioned in the previous training video, we have 4 categories of programs that we fund. There's the screening and diagnosis, treatment and treatment support, wellness support, and community health workers. So you'll see that they're a little bit out of order. The one at the very bottom that does not have a letter is the screening and diagnosis. And if you want to see here, there's the description is the screening RFA, and you can click on this link and it will open up a window that has the RFA document that you can scroll through. Community health worker, RFA-D is here. Wellness support, RFA-C, and you'll see here it has the letter C in it. And then treatment and treatment support is here. And each of these has a separate RFA attached to it. Most of the information is the same, but there are a few differences depending on the category. So you figured out that, okay, I want to apply in the treatment category. So what you're going to do is you're going to apply now, and it's going to ask you, are you sure that you want to do this? Just say, I agree. And now it's going to bring you to what we call the CG application menu. And you'll see that the system has generated a name for your application. Yours is going to look very similar, except these letters are going to be different, and then you'll probably have a different number here. And it shows here, this is my organization, this is my role, this is the role of who did it, application in progress, so that tells you the current status of your application. And then it also gives you the due dates, so the period of the program, and then the due date of the application itself. I'm going to skip this first one because this is where the bulk of your work is going to take place. I'll get to that in a second, but I want to touch briefly on these other ones. So initiate and access reports. This is for after the application has been awarded and you want to do your progress or final report. This is where you would come to initiate those reports. They won't show up here in your report until it has been initiated. This only shows historical or open ones. Hopefully that makes sense. But again, that's on another training. Access management tools, if you click on this one, the things here that are helpful is a full print version of your application. You can create a PDF version of your application once you've completed it. You can also do a blank one if you wanted to have that, set out aside to, help you craft it outside of the system. You can do that as well. There's also another, this is the way that a project director can go in and add an authorized signer to this application. If, maybe the authorized signer registered after the application was initiated, you can do that here, or you can contact us, and that's kind of hard to remember, so I'd be happy to help with that. So to get back to your application menu, you can click on this name right here, and it will bring you back to this application menu. So changing the status, this is where you will go to submit your application. So project director would click here. It's going to say authorized signature required and application canceled. So once you're all done and you filled everything out, you're ready to go, you would apply this status here. If there are any errors in the system, it will not let you submit it until those errors are fixed, and I'll show you a little bit about how that looks in just a minute. Application canceled. I'm not sure why this one is so close to the other one, but if by some bizarre situation you accidentally cancel your application, please, please, please contact us. I can find it and I can get it back. Don't go through and work and do another one completely. Just call me or email me. I can find it and get that reinstated for you. So again, click on this to go back to that menu. Now I'm going to go into View, Edit, Complete Forms. So these are like pages within an application. You'll see that your application RFA is right here as well. You can click on that if you wanted, again, to reference anything that's in the RFA, or if you want to just keep it open for reference or make sure that you're still in the right category. This is how you could do that. So this project profile page, and this is something I want to point out right here, which is this little hand. This is telling you that there are errors or missing information on this page. These will show up for some of these pages, but not all of them, because not all of them are required. So if you're not these are budget pages down here. If you're not requesting supplies in your budget, there will be no error, and you can leave that page blank. Hopefully that makes sense. So, but on the project profile page, you'll see when you click on that, and this tells you what is missing and what is required. So you must enter, the project director, the primary contact. It will tell you what is missing on this page at the very top. You'll notice up here, there's a save button, a print version, and then check global errors. So save button, I can tell you right now, is your best friend. Make sure you save on a regular basis because the system will time out after a certain amount of time, and you will lose all the information if you don't save regularly. And you'll see that this scrolls down with you as you go through the page, so that you always have it right there. And if you've filled this out and you want to create a print version of it, you can do that from here as well. It just creates a PDF of the page. We don't really typically use the note system. Again, most of the communication is done through email. But if you wanted to check errors within the entire application, you can click here and it'll tell you which pages are missing information. So you'll see this, your tax ID auto-populates from your organization page as well as the name and address. You'll need to fill out everything that has a asterisk next to it. So project director, contact information, all of that needs to go here. Title of your project goes here. If your organization is involved with the National Breast and Cervical Cancer Early Detection Program, You will know if you are involved or not, and you can select the appropriate box. Partners, so an organization that you are partnering with to help with the project. You put their name there, what services they're providing, the number of years, and then this is where you would attach any letter of support or MOU with the partnership. If you are a past Komen grantee, your previous funding will show up here. The only one that won't show up is if you currently have an open grant with Komen. It will not show up here. It only shows up once the final report is done and the grant is closed out. So in case you're missing information, that's probably what is going on. So you'll notice here, we've gone through this page and you scroll down and all of these navigation links for the next pages show up at the bottom. So you can just click on the next page, which is Organization Summary. And this is where you're going to talk about your organization's history and mission, current programs and accomplishments, number of paid staff, number of volunteers, annual budget. All of that can go here in the Organization Summary. Then project priorities and abstract. So this is where you're going to select the funding category that you're going to address. So we're in the treatment and treatment support category, so you're going to choose the treatment and treatment support funding priority. If you're choosing one of these other ones, you're in the wrong category. So make sure that you are in the correct category. I would hate to go through all this work and have to have it canceled because we cannot transfer it between the separate RFAs. So if you accidentally start one in treatment and treatment support, I cannot change it to screening and diagnosis. You would have to copy and paste everything out of it and then into the new one once it's initiated. So just be careful. Narrative. So these are all the things that need to go into your abstract narrative. One thing that I will tell you is there is a way for the public to search on our national Komen.org website for community health programs in their areas, or actually anywhere across the nation. And what shows up is this information that goes into this abstract. So this is something that the world sees. So make sure that you spend some time crafting something that's straightforward and direct, full, no errors, no typos, things like that, and really describe how great you all are. So that goes there. I'm going to go ahead and save just so you can see what it will do to you, because it's going to tell you, hey, you've missed some information. So it will automatically tell you that you've missed something on this page and what it is. And you'll also see, again, this now shows up. And this is also something that you may find useful if multiple people are working in the application. It's going to tell you who created the page, who started the page, and then the last modification will show up here with the date and time. So you'll know that if you're working on the same application, the last time someone was in. Project narrative, this is where we talked in the previous recording about all of the information that you want to put it here. This also is a way for people to search on your program. So keywords that pertain to your program, it may be underserved, it may be mammogram, it may be yoga, whatever keywords that you want associated with your program that people can search on yoga programs, and yours would come up. Statement of need, and all of this information is here, kind of what information should go into this. This is also included on the RFA as well. You get 5,000 characters within each of these text boxes. So there's program design, organization capacity, monitoring evaluation, and the overall vision. So one thing that I will kind of give you a heads up about, if you are doing all of the narrative piece in like a Word document, and you want to copy and paste into the system, my recommendation is to copy and paste into a text file or a notebook on your computer to remove any formatting that may exist, because you'll sometimes get weird characters that show up that you can't get rid of. So that's just a little heads up. And then also, once you copy and paste, you're going to need to either do a backspace or a space in order for this little character counter you'll see as I type. It's telling me how many characters I have typed out of 5,000. But the system won't recognize that until some keystroke has happened within the text box. Then it will be able to calculate how much text you have in there. If you exceed 5,000 characters in these text boxes, the system will not let you save it. So make sure that you keep to those character limits, save on a regular basis, save after, a couple of minutes of typing if you're typing directly in, or whatever. So, but just do keep that in mind. The system will not let you save it if you exceed that character count. And it won't recognize copy and paste into the text box until you actually do a keystroke within the box. Okay, hopefully that's clear. So I'm going to save that so you can see what that looks like. Again, it's going to tell me I have errors, that I haven't, typed anything in some of the text boxes. Now I'm going to scroll down here to demographics. So when you click here, you can select up to 6 target populations. So if you serve all races, you don't need to click any of these. If you serve all ages, you don't need to click any of these. Only click if you are targeting maybe a specific age group. Maybe you're targeting specifically, people who are 40 to 49 years of age. You're not serving anybody else, or you're not targeting anybody else. Then you could do that. But again, if you're serving all ethnicities, don't need to worry about that. If you're serving specifically the Hispanic population, then you can click Hispanic. Then here, all of these named groups, there's a variety of options here. So rural areas, maybe co-survivors. Maybe you're doing a program for the kids of parents who've been diagnosed with breast cancer. All of that can go into so you can select specific groups here. And again, maximum of 6 in this area. So you don't want to take up 4 of your 6 if you have people down here that you're targeting. If you're serving all 4 age groups, you don't need to worry about clicking any specific. Target locations. So if you are specifically doing outreach in Carbon County, say, then you can click Carbon County. There is no limit on the county areas. So if you are covering the entire state, you can click all of them. If you are specifically in Iron County, you can click on Iron County. It's completely open to you. You can do as many or as few as you like, but you do need to select at least one. Okay, so that's that page. Let's look at project work plan and goals and objectives. So this is where you're going to create your goal. So here is your project goal description. You're going to type in, whatever it is that you're planning to do. Maybe it's, screening mammograms in Iron County. So you would do your description of what your goal is. Then you're going to create an objective name. So maybe, your first objective is, outreach to 500 women. You would come down here and then put in the description of, we're planning to, within this time frame, reach this many women to provide this particular service. There is a drop-down menu here for the service that best represents your objective. So if you click here, and so I said, mammograms. So I would click here, direct provision, so clinical service being provided directly by the grantee or paid for by the grantee, a free or low-cost screening mammogram. So I'm going to click that. Then I'm going to do my time frame. And typically people put in the entire grant cycle, which is April 1st of 2017 to March 31st of 2018. And then the anticipated number of individuals we serve. So I'm going to say 100. This is where you would upload any evaluation forms, surveys, any documentation on how you plan to evaluate your program will go here. Okay, I'm going to go ahead and hit save. And then I'm going to show you, I'm going to need to put in something here. So, whoops. And then a little bit of information here and hit save. Okay, so I have my goal and my first objective, right? If I want to add another objective, I'm going to come here. I'm going to click add. The goal is going to remain the same, but your objective name here is where you're going to put in, so you did screening mammogram, so maybe you want to do clinical breast exams as well. So you'll do clinical breast exam, you'll come down here, do all of the same information, hit save. And it's thinking, and I'm going to show you down here. So you see now this has a number 2 next to it. That's telling you that you have 2 objectives that have been tied to this goal. How you can navigate between them is here. So the clinical breast exam is here. Say I want to go back to the screening mammogram. I click on screening mammogram, hit go, and it's going to bring me back to my first goal, or excuse me, my first objective that I created. So you'll go through and fill all of that out. Again, you can have as many objectives as you like, but understand that all of these objectives will need to be reported on with demographic information and numbers. So if you can combine some of your objectives into one, sometimes that might be a good strategy. Okay, so now we're going into budget pages. So key personnel, I talked about this in the previous training as well. So any key personnel, the person's name, job title, and the role on the project, you'll see here, there's some options there. And then attaching the resume and job description. If you're not asking for salaries in the budget, that's all you need to fill out, hit save. If you are requesting salary support for these positions, then the total salary will go here. So we'll say $50,000 and then 5,000 in benefits, and they're going to spend 10% of their time on this project. So I'm going to hit save. I'm going to show you how the system works. It will automatically calculate the amount of money that will go into the budget page. So you'll see $5,500 of salary support is being requested, and that will go into our budget page, budget summary page at the end. I'll show you that. And then here is where you provide justification for this request. So, maybe it's a health navigator, that is going to be spending, a certain number of hours a day, on case management. And you just calculate, the number of hours, that type of thing that goes in here for the justification. Consultants and subcontracts go on this page. So any consultant or subcontract that you're working with, hourly rate and then the number of hours, the system will automatically total. If it's a subcontract and it's just we're saying we're paying $1,000 for someone to come in and do a project with us or for us, then that total amount would go here. Again, there's a justification section for the request of that funding. Supplies, same thing. You just go here. You would, put the name, number, cost. It will total it for you. Again, justification. Travel expense. So this is travel expense for employees of the organization. So, you know, let's say that you were requesting, you know, travel to go and do a presentation in St. George. You can put the employee travel here. If it is patient travel, that will go into the next one, which is patient care. So you'll see here this is broken out into different areas. So we have screening, so clinical breast exams and mammograms. The total cost would go here, diagnostics, treatment, other patient care, and transportation. So if you are providing transportation for a patient or you're providing gas cards, if it's patient transportation, it goes here. If it's employee travel, it goes in the other one. Hopefully that makes sense. Again, justification for everything. Other is anything that we haven't covered in the other pages. So you just provide a description, the total amount, and the justification. Indirect cost. So this is where the $5 million umbrella insurance policy will be budgeted. So your direct cost subtotal. So let's say you're asking for $15,000 total for direct costs. The total amount, the maximum percentage allowed is 10%. You know, if you only need 5% to pay for your insurance, you can put 5% here. I'll just go ahead and put 10% and you'll see. And then the justification is, you know, to pay for the premium for the $5 million umbrella insurance policy. Again, that is the only thing that can go in this area. If you already have that insurance, you don't need to ask for funding for it. But again, we want to make sure that you have the opportunity to get that taken care of, because I know it can be a burden for some smaller organizations. Okay, so we've gone through our budget items. Now we see project budget summary. And this is, you'll see, you know, the salaries that we put in showed up here, our indirect costs showed here. And then let's say I'm going to, you know, we have $5,000 that's coming from another from our budget, and then we have someone that's, you know, an in-kind of $5,000. I'm going to hit save, and I want to show you what the system, how the system does this. It automatically then adds up. So this is the total you're asking of Komen. This is how much cash that the organization is contributing. This is the amount of in-kind services that are being provided to the organization. So you see that the total amount to run the program is actually $17,000. So all of this information is really helpful to go in here. And then again, justification for the cash and in-kind funding, you know, kind of where those sources are coming from. So what percentage of the organization's overall budget is requested from Komen for this program? That percentage goes here. Any financial information that we have asked goes here. So the nonprofit documentation, the board of directors, the you know, operating budgets, all of that information goes here. And if you fill these three up, you'll have more options that come after you hit save. And then here, so one of the things in order to, and this is something I don't know that I spent a whole lot of time with, I may not have mentioned at all in the last one, but in order to fit into one of our categories, 80% of your budget needs to be dedicated to that category. So you'll see here that screening and diagnosis are actually broken into separate categories. If you're doing 50-50, that's still 100% in the screening and diagnosis category. So don't worry about that. But we want to make sure that if you're doing screening and then providing some education, that 80% of your budget is actually going to the screening, and then you can do up to 20% in education or some other category. So treatment and treatment support, obviously, again, same category. Survivorship is the wellness support. You know, so maybe you're going to do 80% to the wellness support and then 20% education, you know, outreach and, you know, trainings outside of your organization that can go there. So that is pretty much it. Like I said, once you get all of your pages and everything full, you can come back here to your application menu, and then once you're ready to submit, this is when you would come here and do the authorized signature required. Okay, so that is the system walkthrough. Okay, so now we're back to here. Again, I talked a little bit about this already, application submission. It's a two-step process. Make sure that your authorized signer is available, knows their login, knows their password, everything to be able to submit. I recommend trying to submit early and not waiting until the day that it's due. Systems often go down, computers have problems. I would rather not have to field a phone call at 5 minutes to 5 from someone panicked saying that the system won't let them submit their application. So please plan ahead, do it early, get it done, and then you can have a stress-free Wednesday. Again, I talked about this already, changing the status and then the two options there. I'm not going to spend time going over this too much, just very quickly, just to kind of point out a few highlights that will help. Number one, read everything. Make sure you read through the RFA and you understand what is needed. Know that the proposal, the application itself takes a considerable amount of time to put together. So plan ahead, make sure you start early. It's going to take a while. If you want to look through the community profile, there is an executive summary that is on our website as well as the full report that kind of give you an idea of how we came up with our funding priorities. Be compelling and concise. With your abstract, you only get 1,000 characters for that, but make sure it is your best 1,000 characters, free of typos and spelling errors. Evaluation process. So again, there is a process evaluation of how well the program worked, and then there's an impact evaluation. So the process evaluation is what happened, how it happened, how much, where, and to whom. So this is how well did the program you put in place work. Then there's impact evaluation. So this is the impact that it has on the people that you're serving. So were there changes in behavior, knowledge, attitudes, or beliefs? Changes among individuals, providers, organizations, or communities. Maybe you're doing an education outreach for primary care providers to recommend mammography. Any change among the actual people that you are serving would be part of your impact evaluation. Budgeting expenses. Be realistic. I love this sentence, projects become reality because the central idea is sold, not because the proposal is cheap. Granted, we have caps on the amount that you can ask for, but if you really need the amount of the cap, then ask for the amount of the cap. Don't try to sell yourself short or your program short by trying to run it on the cheap. Ask for what you need, and again, justify your expenses. Explain why this is necessary. We try to fund all programs at 100% of the ask, but sometimes things happen. Budget items aren't clear. Reviewers will say, I don't understand why they're asking us to pay for that. We don't want to pay for that. Or you may have hit our funding line and we only can fund part of your program. So make sure in your budgets that you spell out specifically why you need those things, why you're asking for this money, and how it's going to be used, and split them out. Don't lump everything into other and have 10 things that are in that other category. Make sure that you clearly spell them out of how the money is going to be used. Again, read the RFA carefully, follow the instructions, write clearly, avoid jargons or acronyms. So while we have, very intelligent people who are reading these applications, They may not work in the same field as you. They may be in finance, or they may work in another nonprofit, or they may be a survivor that doesn't know some of the acronyms, medical acronyms that are out there. So make sure that you do this, that you create your application and explain and communicate clearly what it is that you're trying to accomplish, that so that make sure that anyone from any background can understand what you're trying to do. And then again, allow plenty of time. Submit early, submit early, submit early. Okay, since you can't really ask me any questions, I'm going to skip the question and answer time, but I'm going to put this screen up. So this is my contact information, Leanne Peters, Mission Manager, phone number, and email address. And there is an applicant manual that is available on the website that will walk you through all of the steps of the application. So if you follow the steps exactly as written, you should have absolutely no problems. If you do run into issues, feel free to contact me. I'm happy to help as best as I can. Best of luck, and thanks for listening.